Good morning to Maquedes City. Today is February 24, 2022, Thursday. I'm Katie Esmeralda Caisan, and you are watching CNN News. Mental health in the Philippines continues to raise concern amidst the pandemic.
Yung anxiety ko muna, talagang ang laki ng pinagbago sa akin.
COVID-19 pandemic in the Philippines is said to have significantly affected the mental health of the Filipinos, as the estimation of individuals facing mental health problems rises to 3.6 million according to the Department of Health, with conditions including depression, substance use, and mood disorders. As this problem continues to spark concerns, the DOH's Mental Health Division Chief Health Program Officer Francis Pesella Cuevas has released a statement earlier this morning, and I quote, "As the Department of Health and our health workers strive towards coping and living with this pandemic, we must find ways to care for the mental well-being of our fellow Filipinos who continue to suffer because of this current circumstance." End quote.
Meanwhile, in Dumaguete City, a cognitive therapy center is to be established by Dr. Emancino of Alcon Mental Health Institute that is said to address the increasing rate of depression and mental health problems in the city. To answer our questions about this, we're currently joined live by Dr. Emancino himself. Good day, Doctor.
Good day, Ms. Gaisan, and to our viewers right now. I hope that everyone is doing fine and well.
So, what is cognitive therapy and what made you want to establish a center here in Dumaguete City?
Cognitive therapy, or what we call cognitive behavioral therapy. Cognitive therapy is based on the idea of how we think or cognition, how we feel or emotion, and how we act or behavior all interacts together. This focuses on a person's current situation rather than the past and looks for a solution to problems in the present. Cognitive therapy helps people achieve specific goals or changes in their lives and focuses on their views and beliefs about their lives rather than their personality, upbringing, past trauma, or mental illnesses. There are three features of cognitive therapy. We have first, cognitive therapy focused on the present, not in the past. We have second, cognitive therapy is results-oriented. Number three is cognitive therapy involves learning skills. So cognitive therapy actually starts with situation, automatic thoughts, reaction that involves emotion, behavior, or physiologic responses. So basically, cognitive therapy starts from the way we think or cognition, the way we feel about it or emotions, and the way we behave or act. So situations does not affect how people feel, but rather how they interpret or perceive the situation. It's mainly on how people understand and think about the situation is linked to how they feel emotionally and how they have been behaved. Automatic thoughts, without conscious reflection, automatic thoughts really develop spontaneously in the mind prior to treatment. So most patients are often unaware of their automatic thinking and are far more likely to be aware of their emotionals, behaviors, and physiologic responses. We have here BECK'S cognitive triad. We have the negative triads of automatic thinking, which refers to under three forms of negative, helpless, and critical thinking that are typically of individuals with depression. Now let's start with first, negative view of self. We also have here negative view of the world. We also have here negative view of the future. Okay, it's basically on the person's automatic thinking, how they feel about a certain situation. So we have here cognitive distortion, or what we call errors in logic. We have here the individual's habitual method of thinking that tends to be negatively biased, which usually develop as a result of unwanted events or situations. First is we have polarized thinking. These are reducing complex outcomes to absolute by thinking in black and white. Okay, so catastrophizing fortune telling, which is the second one, is assuming that things will go wrong despite the fact that it's a known fact. Third is disqualifying or discounting the positive. Number four is emotional reasoning. We have drawing a conclusion based on an emotional state. We also have here labeling. So this is a type of generalization in which feature or incidents becomes unmistakable, resulting in an unnecessary severe label of one, self, or others. Number six is mental filter or the selective abstraction. We have mind reading. We also have overgeneralization. We have magnification or minimalization, which is an exaggerating or downplaying the significance of something. We also have here personalization, and we also have here should and must statements or the imperatives. And lastly is the tunnel vision. This refers to the negative aspects of the situation. So a person only sees the negative aspects of a certain situation. So now let's move on with the overview of the cognitive theories for several disorders. So basically, these could be disorders that could possibly be addressed by cognitive therapy. We have here depression. We also have here bipolar disorder, panic disorder, generalized anxiety disorder, obsessive compulsive disorder, eating disorder and obesity, substance use disorder, and schizophrenia, which is delusions or hallucinations.
It is very promising indeed, doctor. If I may ask, what are the procedures that a patient may undergo with cognitive therapy, or as you said, cognitive behavior therapy?
Well, generally, patients undergo for about 3 to 6 months durations of therapy. However, the frequency of each of our session is not predetermined, meaning it is case by case basis. So patients who decides to cognitive therapy will need to undergo three phases. During the initial phase, we are going to get information from our patients in order to know the symptoms they are experiencing and the related factors that can cause for these symptoms to worsen. After which we will do psychoeducation where therapies educate our patients and their family about their present condition. Our treatment plan and introduction of support groups. Then we will transition to the middle phase, which is most active phase. This involves regular treatment sessions where they can learn different types of CBT techniques or the cognitive behavioral therapy techniques, and many more. So once the occurrence of symptoms are reduced, next will be its determination phase. So where the frequency of therapy sessions are reduced and patients are given a greater responsibility for the implementation of techniques over a long period of time. And if necessary, we can also provide booster sessions once a relapse or symptoms occurs.
Thank you for your time, Dr. Mencino of Alcon Mental Health Institute. To continue our discussion about cognitive therapy, we're also currently joined live by Nurse Director Ebrole of AZ Mental Health Hospital. Good day, ma'am.
Good day to you too, Miss Gahisan.
So, AZ Mental Health Hospital is also in collaboration with Dr. Mancino's Cognitive Therapy Center here in Dumaguete City. So, if I may ask, ma'am, what do you think is the involvement or contribution of nurses with CBT?
Before I begin, I would like to wish our viewers a good day to you all. With the news of a CBT center being established in our city, us nurses can't help but feel hopeful for our patients and also for ourselves that we will be able to reach out and help those people with problems involving their mental health. We all know that as nurses, it is our job to care for our patients, not only physically, but also mentally and holistically even. Just because mental health problems can't be seen to the naked eye doesn't mean that a person isn't experiencing any mental health issues. We can't really come to the conclusion that since a person is always smiling or laughing, that they are fine and they have no problems mentally. It is still there and it will continue to thrive unless we do something about it, unless we do an intervention. And since Dr. Mancino already tackled about CBT, My role here is to tell you about the involvement of nurses in this theory. Since the goal of CBT is to replace one's negative, distorted thinking into a rational, positive thinking, it will greatly benefit our patients who suffer varying mental health problems. It can also help in improving difficult behavioral problems such as gambling or alcohol or even drug addiction, and we also help with non-adherence to medication. CBT aims to stop negative cycles such as these by breaking down things that make you feel bad, anxious, or scared. By making your problems more manageable, CBT can help you change your negative thought patterns and improve the way you feel. Psychiatric nurses work to improve or support the mental and physical well being of people with mental health or behavioral conditions, and sometimes it may also even involve the family members of the patient. They would also go through CBT. Through CBT, we will be able to make use of therapeutic communication with our patients, and we can also encourage them to think positively. CBT will also help as nurses build rapport with our patients and strengthen our relationship with them, encouraging a trusting environment between the two parties. In CBT, it is important that we work together with our patients. We let them find solutions or positive reinforcements on their own to combat their way of negative thinking. We will just be there to guide them, to redirect their negative thoughts, and then it is our job to nurture their positive thoughts that they came up with themselves, and then use it as a stepping stone for them to discover what to do next. All it takes is one single negative idea to pop up, and we will be immediately flooded with overthinking and catastrophizing, which will then lead to a myriad of twisted thoughts. So it is important that we will be able to rationalize our way of thinking and take the necessary measures in order to think clearly and replace the negative thoughts with realistic ones. All in all, I hope that this CBT center will flourish and that we will be able to help a lot of people through CBT. Let us work hand in hand in order to create a safe space for our mental health. Thank you, everyone, and have a great day ahead.
Thank you for spending your time with us, Nurse Brole of AZ Mental Health Hospital, and have a great day. And that's it for our latest news for this hour. I'm Kenny Smil Jason, and this is CNN News.
We may feel sad or gloomy at times in our lives, and these feelings will pass like a passing storm, but not for me. My sadness didn't go away. It lasted weeks, months, and even years. I felt terrible, hopeless, and hated myself, downplaying any positive aspects of my life. That's when I consulted a doctor, then a psychiatrist, and finally a therapist. I was diagnosed with severe depressions, and to aid with my symptoms, I was prescribed medications. Then I was introduced to cognitive behavioral therapy by my therapist. It gradually became clear that I was having a lot of negative and irrational thoughts that contradicted facts. As a result, cognitive behavioral therapy helped me in learning how to reconsider and reevaluate my viewpoint. It showed me how my negative thoughts would combine with strong emotions that shot me down and make me even more depressed. I can easily see now that I used to view most things in my life in a negative way. I was able to change my thoughts into a positive statement after learning to recognize extreme negative thinking. I started addressing my fears with positive reinforcement strategies, and with time, I was able to calm myself on my own. Things started to get simpler to manage after I changed my mindset and set logical goals. While to track my progress and set goals, I now use this activity scheduling, even journaling, and self management. Well, cognitive behavioral therapy enables me to become more aware of inaccurate or negative thinking, allowing me to see difficult circumstances more clearly and respond more effectively. And I'm proud to say that I am on the road to taking my life back, and that's something to feel good about.